Hey there, my name is Catherine. I'll be your nurse today. Coming in to do some trach suctioning. Got our BVM mask, our trach dilator, our extra trach kit, sterile gloves, our chuck, our saline, and my goggles. So like I said, I'm gonna be trach suctioning. I just need you to go ahead and confirm name and date of birth for me. Awesome, Mr. Original. So, what I'm going to be doing is just taking this little kit that I've got here, and it's got a little suction tube in it, and I'm just going to suction all that gooky stuff out of you, so that way you're breathing a lot easier, okay? Any questions for me? No? Okay, perfect. So as I'm doing this procedure, there shouldn't be anything that's painful for you. You shouldn't have any problems breathing, but in case you do, you get uncomfortable at all, you find yourself short of breath, just go ahead and raise your left hand for me, and I'll stop immediately and we'll get that taken care of for you, okay? All right, awesome. Any questions for me? No? Perfect. So what I'm gonna do before we get started is I'm gonna check your respiratory rate, your effort of breathing, your O2 saturations, and I'm gonna listen to your lung sounds. Okay, did that, perfect. Now I'm gonna go ahead and turn this on, suction on to 80 to 100 millimeters of mercury. I'll grab this glove here. My hands are a little sticky from that. Every time I hand sanitize, I can never get gloves on properly. All right, got it on. All right, I'm gonna just go ahead and check. Make sure that's working, and it is. Perfect. So I'm gonna go ahead and slip this chuck on. Make sure I don't get any yucky stuff on you here. Go under here. I'm gonna unsnap this. I'm not gonna remove it yet. All right, now I'm gonna set my station up. I'm gonna get these. Put on. I'm just gonna put them on like that for right now, so I can see what I'm doing here. This is open, so I'm gonna go ahead and discard some of it here. Perfect. Check expiration date on all of my products. Everything's good. I'm gonna take the label, stick it in my hand there, pull this on out of there without touching anything else or contaminating anything. Pour that in there, close that up, get that out of my way. Without touching the sterile area, I'm gonna move this over to the side. Now I'm going to grab my gloves, touching the outside, nothing in the area on the sterile field. Just trying to make sure it's nice and flat. I would also be putting on a mask as I'm doing this, just so we are all aware. Get right underneath there, not touching the sterile field at all. Again, I'm just gonna kind of shift this without going over my sterile field. Going around the border so I don't contaminate anything. I'm gonna start over here, picking up right glove. I'll wiggle this on. All right, as I'm getting these on, I'm also going to mention that if I was doing this through your nose, I would use lubricant, and I would go, if I could get this on here, 5 to 6 inches, but since we're going through the oral pharyngeal route, we're gonna go 3 to 4 inches, and we are going to be suctioning for no more than 10 to 15 seconds at a time. I could do this up to 3 times to make sure that everything is nice and clear for you. But once I get in there, we'll see how many times we need to do it, okay? Trying to adjust, not touching the inside of my glove at all. Got that. So now what I'm going to do is I'm going to grab this here. I'm going to make sure it doesn't touch anything. I am going to take this and wrap it around my dominant hand, holding that here. This hand is no longer going to be sterile because I'm taking it and inserting it here. Okay, so now what I'm going to have you do is I'm going to have you take 3 to 4 deep breaths, get you nice and oxygenated, hyperoxygenate you, and that way you don't get a short of breath while I'm doing this, okay? My unsterile hand, I'm going to move these down. Pinching my face. So what I'm going to do is I'm going to, okay, good, that works. Now I'm going to remove this after you've taken your 3 to 4 deep breaths. Get that out of your way there. Without touching the outside or your chuck, go in. Perfect. Wrap this back around my hand. Place that back over you. Unwrap. Get all that junk out of there. I would turn. I would check for coca. Make sure there's nothing alarming in that. If I needed to suction you for a second time, I would wait 30 seconds to a minute, and then I would have you hyperoxygenate again. However, I believe I got everything out of there in that time. So now what I'm going to do is I'm going to go ahead and remove this. Place this back up here. That in there. Do this here. Remove these. Remove my mask. Clean up. Carefully clean up. Clip this back onto you. Uh-oh. Where did we go? There it is. Clip that onto you here. Get this off of you here. I would note the size of the catheter that I used. I would note your respiratory rate, effort of breathing, O2 saturations. Listen to your lung and document how you reacted to the treatment. I would make sure that there was nothing else that you needed while I am here. I would make sure that your bed is returned back down to a safe position. You're back out of the semi-Fowler 45 degrees. I think that's it. Other than documentation, making sure you're good to go. Is there anything else that you need? Nope. All right, here's your call light. I'm gonna go ahead and put this back over here as well. If you need anything at all, you let me know and I'll be right back in to take care of you, okay? All right, perfect.